Hi, Daryl Combs here. Are you on Wikisana?
Welcome, dear viewers, to our format Natural Medicine. Many people keep searching for a solution to cancer. There are also many alternative ways, but is there also a new chance like toxopheresis? What exactly does it do? How can we support the body? From what should it really be relieved? And how everything is interconnected, you'll find out soon. Stay tuned. Hello, dear Harald. Nice to have you here.
Hello, dear Corinna. Thank you for the invitation. Good morning.
You are a specialist in internal medicine. For over 20 years, you've really been focusing on the holistic approach, including the detoxification of environmental toxins and pollutants. You have an incredible amount of experience. And now we are in a special time where, of course, a lot of cancer is occurring in our society. And to what extent do you currently see the situation with the patients?
Yes, so we see two developments. We see firstly that there are more and more patients who are really seriously chronically ill and also develop cancer. And secondly, we see that the patients are getting younger and younger. These are two unpleasant developments.
And from a dynamic perspective, often the patients come and say, yes, I see no way out anymore. Yes, when one comes to you, then one has already tried a few things, has already gone down a few paths. Yes, one doesn't just, yes, I have something undefinable here and now I'm going to the specialist.
Yes, I mean, we've been seeing for decades that through operations, radiotherapy, chemotherapy, we can help people in some form. But there are, of course, limits. These exist with every procedure. And, of course, thanks to the internet, there are more and more people who are also looking for alternatives who say, okay, I would like to know more additionally. What's going on? What could the causes be? What can be done to prevent a tumor disease? On the one hand, or if you have it, how can I achieve a better quality of life? How can I prevent recurrences and so on? And there are approaches with which you can do that. I myself have some patients with severe illnesses, severe tumor diseases, who had a very low chance of survival, now living 8, 9, 10 years. Yes, of course, not always completely tumor-free in all those years. Then something comes up. But if you catch it early, you can do something again, and you can regulate the immune system in such a way that it becomes stable, enabling it to fight against tumors on its own. And there are different strategies for how you can do that.
You've brought us a few slides. Let's get into them.
Today, we want to talk about toxopheresis, but perhaps let's start briefly with the causes. Toxopheresis is, as already mentioned, a complex, multifaceted matter that is partially determined from the moment one is born. Depending on what happened with the parents, whether they smoked a lot, drank a lot, or whatever, there are 1,000 things. And naturally, there is also an individual tolerance threshold for all environmental impacts that can play a role. Some people can tolerate a lot. They can smoke and drink all their lives, as the saying goes, and never get sick. And others can only do it minimally and still get sick. And these are things we cannot influence, just like the interaction, the exposure duration of toxins.
If you now talk about pregnancy and poisoning, the placenta is not capable of filtering heavy metals. Meaning if the mother, of course, has her amalgam fillings and the child then gets rheumatism, are you able to analyze that? If a mother now says, now I have learned that my baby might really have a heavy metal burden because of my amalgam filling. That one says they do a check.
Absolutely. So we can, of course, test the mother, but we can also test it in children. With infants, you don't do it. But I test the youngest children from about 3 years of age. This can be done preventively if they are conspicuous in any way.
That is already a prophylaxis if I know that the burden was there.
Everything I remove in terms of environmental toxins, toxic metals that can cause all kinds of disorders or paints, varnishes, coatings, or what is in there, microplastics and what we have. If I remove it early, it obviously doesn't cause any more trouble.
Sure. Well, okay.
Yes, then you can see, as mentioned, what has a long-lasting effect. The longer something affects the body, the longer it can cause damage. And then, of course, the genetics, the way you detox. I recently had a patient who came and had a detox profile that was missing 50 detox enzymes. Or rather, they weren't missing, but they either weren't present or they didn't function.
Do you do that through a genetic test?
We do that with some people, and you don't always do it. because those who come with a high load, where we find many toxins, of course have poor detoxification. One could basically claim that we do it every now and then, it's just relatively expensive. So you don't do it with every patient. But we simply see that those who come to me, to the clinical environmental doctor, are just poisoned and detox accordingly poorly. And that's why you have to use procedures that bypass normal detoxification, such as by the liver, to get the stuff out. Either through chelation therapies or through the toxopheresis, where you just do a bloodletting and take out the stuff. And a genetic reaction to inflammatory stimuli, that's also a genetic thing, how you react when something enters the body. Whether you have a bit of an inflammation that subsides or whether your inflammations flare up and can't be controlled, these are things you can't naturally influence because they are predisposed. And then, of course, there are things you can influence, like how you take care of yourself. Do I eat well? Do I eat organic or do I eat fast food? What is it called as the main diet? Am I supplied with vitamins, minerals, trace elements? That is simply necessary. Just as we know that a car needs good gasoline, good oil is needed, enough air in the tires is needed, and maintenance and so on, it is also necessary for the body. Only more complex, more complicated. However, we are more inclined to intervene with the car than with the body. And then always important is also the bowel function. Are there any disturbances in the bowel? Are there any foci in the body that provoke inflammations? And how is the lifestyle? How is the stress? Those are things that we can influence. And then there are things that I can influence therapeutically. You can't influence them, but the therapist can influence them. And it mainly concerns these multifactorial causes that come from outside. We always learn we have a genetic predisposition, a tendency. Some families are prone to cancer, others to diabetes. But we also know that this tendency, these genetic switches are turned on or off by epigenetic factors. That is stress, that is lack of exercise, that is poor nutrition. But these are also these masses of environmental toxins like amalgam, lead, paints, lacquers, coatings, microplastics, the entire solvents. What we all have around us, it is estimated to be 350 zero substances with which we could come into contact in such a way. The body cannot detoxify them. And I often see patients who come and say, I've been eating organic for 30 years and I run and I drink good water and I do this and that and that. That's great. But if you have a car, to come back to the comparison, and you clean it every day, you have new tires on it, there's tire pressure on it, washer fluid, everything in it, just no engine in it, then it doesn't work. And the engine, those are the detoxifying enzymes in the cells, if you will. And if these do not work, then nothing will come of the detoxification of the body's own. So you have to have a procedure that pulls the stuff out from the back. And that's what we can do. Because these environmental toxins have an inflammation-promoting effect. They cause chronic inflammations. And that's the problem with cancer. We essentially have three cell groups, C cells, restricted, unrestricted, and natural killer cells. These three cell groups, they're basically your soldiers that monitor when tumor cells form and kill them off. The problem is that these three cell groups are either not formed at all during chronic inflammation, or they are present but dormant. And in both cases, this is not an effective defense mechanism. Therefore, it is important to recognize and eliminate these chronic inflammations. These environmental toxins act on hormone receptors. You have to imagine, for example, with breast cancer, everyone knows that women are given hormone blockers because it is known that estrogen and progesterone promote the tumor. So estrogen and progesterone, similar effects are also induced by metals, for example. They attach to the receptors, or other environmental toxins do. They attach to the receptors, which are basically the keyholes where you would insert the key in a door. These are cells' receptors. That's where they attach. And then the blockers act, then important substances cannot work. Or they have a stimulating effect, like for example on estrogen. And then they create an estrogen-like effect, which one actually wants to prevent. And thus it again results in a tumor-promoting effect. These are things that I can remove if I know about them. Then of course there is the toxic effect. Not only the hormonal effect or the inflammation-promoting one, but the toxins also have a directly toxic effect on the body cells and on the intestinal bacteria. If I have glyphosate in my body, for example, everyone knows that. It primarily damages the intestinal bacteria. They naturally trickle through my body, but primarily damage their metabolic pathway, which is called the Shikimate pathway.
Then you have the intestinal fungus, which wants to protect you from the toxins.
Pardon?
Then comes the intestinal fungus.
Yes, of course, the intestinal fungus then also comes. And you also get more inflammations. Above all, when people are heavily metal-laden, because fungi and parasites also absorb toxic metals. And then the fungi go up. If you eat the sugars, then it potentiates. And then, of course, we have many substances that simply have a toxic effect. And we always find them in the toxopheresis, where we find a multitude of substances. And when people then come and say, okay, we now have such a tumor disease, then conventional medicine will, of course, operate, do chemotherapy, radiation therapy, antibody therapy, which is more modern. But in all of this, I repeatedly see, and any family doctor can test this too, that these people still have high levels of inflammation going on. And that's exactly what I just said. As long as the inflammation levels are high, the body's own defense is poor.
Do you do this via a CAP or CAP sensitive? So do you really see the correct inflammation value?
Yes, you see a multitude of inflammation values. You don't just see CRP or elevated ESR, you see TNF-alpha, interleukin-6, you see the TAU, TATU, defense arms, they are shifted. You see that in many things, ECPO and so on. There are a lot of values that are conspicuous. I recently had a patient, a rheumatic patient, who had received biological therapy. So biologics, that always sounds nice. It is an immunosuppressive therapy. Then they are told that it is then stopped, but she had 12 significantly elevated inflammatory markers in her blood. That means all the chronic inflammations continue and then either lead to cancer, diabetes, or nerve damage, or other nasty things. And that's the danger there. And you have to measure that, but that's not done in conventional medicine. And if then everything goes wrong and you've basically passed the point where you can heal, then adjunctive or palliative treatment is used. And that's why we go complementary to that. Goes and takes a look what's wrong with the person. Does he have deficiencies? How is the current toxin intake? Many come and take in too much lead because, for example, they constantly drink tap water. Or they take in too much mercury because they constantly eat raw fish or something like that. I naturally have to stop that first. Because on the one hand, I can detox, but if I perpetually introduce the stuff, it's like when I'm constantly losing oil and just keep adding oil to the car and it always leaks out. That also makes no sense. And then it's about checking what kind of inflammations do they have. You do inflammatory markers, you look at the cytokines, interleukin-6, etc. You check if there are foci, what's going on in the dental root area. I find a lot of patients where there are simply chronic inflammations present. And these are coffin nails. Unfortunately, that's just the way it is. And then you have to find a dentist who is familiar with it, who then restores it. We now have a network of such colleagues who can really do it well, but you have to look after it. Chronic sinusitis, chronic tonsillitis, chronic bowel disorders. These are all sites where inflammations are generated, which then checkmate your tumor surveillance. Unfortunately, you have to say it like that. Bowel disorder, leaky gut, leaky brain. So leaky intestinal mucosa, where substances from the intestines, which normally should not pass through, simply march past the gaps. And then they cause inflammations behind them. They burden the liver. They lead to inflammations in the brain. Then people become scatterbrained, then have concentration disorders, fog in the head, brain fog, and what comes next? These are the consequences. Or what we also repeatedly recognize in these patients, that they are full of pathogens, that they have an active burden with toxoplasmosis or with Lyme disease or with Epstein-Barr or with whatever. And that also leads to chronic inflammation.
Is it true that the pathogens feel comfortable in such a poisoned body that if I now, for example, start a detox, Toxoplasma gondii can no longer take hold?
Well, whether they feel comfortable, I don't know. You would have to ask them, but it is indeed, as you say, they can spread there. And precisely for the reason, when toxins are present that block defense, trigger inflammations, then the defense against pathogens is simply poor. If you then go and say, the person has an inflammation, now I'll give them cortisone or I'll suppress the immune system with biologics, then the defense against such pathogens is even worse. The example we all know is, if you have mice in the house and I lock the cat in the cupboard, then they dance on the table. And that's exactly what happens then.
That would also be an explanation. I recently had rheumatism in my circle of friends, medications, then a special medical measure where we have a bit of a topic with it. And then now lymphoma. So that would actually explain exactly what's going on here.
Yes, that's exactly the point. We've known for years. You can read everywhere, in the Bild newspaper, in Stern or Focus. It's been well documented for a long time what silent inflammations can do. They can trigger cancer, they can trigger diabetes, they can trigger arteriosclerosis, vascular calcification, heart attack, stroke, but they can also trigger neurodegenerative diseases. We have more and more patients with Alzheimer's, with dementia, etc. Just yesterday, the newspapers were full of it. These are things we simply see. This is not hocus pocus. Any conventional doctor can read about it. I can read about it everywhere. It happens due to chronic inflammations, which then checkmate the body's defense. And that's what we're seeing here. And if I then don't have degraded inflammatory and autoimmune complexes, or if I have environmental toxins, then I can extract them. And there is the toxopheresis, the blood purification for environmental toxins, which is now a very beneficial tool with which we can really help people to remove a really large amount of things and demonstrably lower the inflammation values significantly with each treatment. You can easily measure that in the blood. We measure a whole range of parameters in the blood of all people beforehand and naturally monitor it over the course of time that these things regress. Then, of course, it's clear that holistic therapy also involves looking at how the people's diet is. Do they have too much histamine? Do they eat too much sugar? Do they have deficiencies in anti-inflammatory substances, omega-3 fatty acids, and much more? That is part of it. And when a person comes to us and says, okay, I have this illness, and we identify these things, and we also see that they have relevant toxic loads, then one can, on one hand, certainly proceed and do a chelate therapy, but that only removes metals, which already have a strong effect. But I can use blood purification to remove any kind of environmental toxins. Here, PCB, DDE, these are pesticides, insecticides, benzenes from combustion residues, solvents, paints, varnishes, microplastics, silicones, spike proteins, and all that stuff. And then the inflammatory substances lower, as we briefly mentioned before. We see I can take out interleukins, I can remove pathogen toxins, the blood sedimentation rate, CAP, what you just mentioned, fat oxidation decreases, nitrotyrosine, TNF-alpha. These are all inflammation values. We measure these, and when these things are high, you cannot defend against tumor cells yourself. That is a bold claim, but you can read about it everywhere. We can extract autoantibodies, we can extract circulating immune complexes in the body. These are all things that trigger inflammation. And that's why it's so important to get them out. Not only with cancer, but also with rheumatism and other things, but even more so with tumors, because a tumor disease can potentially kill you. And that's how it looks.
Now you're saying, of course, pull it out, pull it out. Then you think, if it pulls out so many bad things, does it also pull out good things? Can the filter decide whether it's a valuable magnesium or selenium or an interleukin 8?
Exactly. The question is also asked again and again. I also hear it repeatedly with chelate therapy. You extract very important things. We have measured it all. These filters, they're not a sieve, they're a sponge. It has a certain pore size and it extracts toxins, the circulating immune complexes, as I just said. But low molecular things like magnesium and such are not extracted. We have measured it multiple times. Of course, there's a minimal loss of certain things, but nothing significant. That's why the side effect rate of toxopherese is minimal. What you notice afterward is a bit of swelling under the eyes, on the hands, on the feet for a few hours. That always goes away. Some people get a bit huarse. I have never seen more in several thousand apheresis treatments, but of course, we also replace these things. The patient then receives, during and at the end of the toxopherese, a few infusions, an infusion with a few substances in it to balance it out. That always comes from me. Once I have the analysis, then also something that he can take orally, whether it be vitamins, minerals, trace elements, what we know, selenium or whatever, that always goes with it. So it's not just holding the arm, sucking it out, goodbye, but the whole package, I call it the holobiont concept, where you really consider everything, that always goes with it. But relieving the environmental toxins is a very, very important point. We couldn't achieve that so far with the chelate therapy in that form. We should only remove the metals, the toxic ones. Now much more can be done. If you look at the broth, normally it's a very clear light liquid. What you see down there, there's real dirt in it. That's how it always looks with people. Of course, that becomes less from time to time. Sometimes it's also the case that someone comes and we pull something out. Then the next day comes, we always do two, back to back at the beginning. Then a lot more comes out. which does not always reveal everything at the beginning. We know this from all detoxification procedures. Then you see a variety of toxins here. We always look at least 60, but sometimes we also look at a whole range of other things. You will then find this in people's bodies. Also the purple ones here, for example. These are typical things that we find very often. Others are not found so often. These things make you sick. Then the toxopheresis also removes viruses. It can also remove the toxins of fungi and bacteria. If I reduce the toxins, the pathogen is also weakened. We always see that the blood-brain barrier is also sealed. I can measure this immediately in the blood. This also lasts. I often measure these values repeatedly afterwards. If I seal the blood-brain barrier, toxins do not enter the brain as easily. The brain is protected. It improves energy production. Every person, especially the tumor patient, needs energy. You need energy everywhere. It improves the flowability of the blood. And what is very important, the therapy is gentle and well tolerated. It is well tolerated in adolescents. It is very well tolerated in sick elderly people. That's why I'm glad that we also have this tool. When I have a cancer patient, it is always important that we can push back the inflammation. I can achieve that with it. Of course, also by restoring the intestine.
Now, cancer is such a word. One could also call it a propaganda word. How do you differentiate the cancer diseases? There are many different forms. Can I use the word cancer in this case in general terms? Or do you have different approaches?
Of course, there are different types of cancer. But in principle, what I have now said is typical for all types of cancer. If someone, of course, gets skin cancer and has had permanent UV exposure, then that is naturally the cause. If someone has worked somewhere in the industry and has worked with some kind of solvents all day, then they naturally have a high exposure there. But in the end, what happens is that it leads to inflammation, that the immunity gets weaker. At some point, tumor cells can form, and then it happens. I cannot reverse radiation exposure, but I can reduce the surrounding factors. What else causes problems so much that the immune system is relieved and can attack better? We see that it simply helps many people. I cannot help everyone either. That is also quite clear. 100% is never possible. But the quality of life, which can be improved, and a longer life, these are all things that we have experienced many times. And then those that happen eliminate the causes of inflammation.
Have you ever looked at how sustainable that is? We are being poisoned all the time.
Yes, of course. That is also a point. You have to, of course, with those who have poor detoxification, always look at what they are reloading. I can't wrap you up in a full body condom. Breathing, eating, drinking is just part of life. We manage it worldwide in the community of life to pollute ourselves with everything. The seas and the rivers and the fish and the meat and everything are so poisoned that we actually can't avoid absorbing something. That's why I tell patients who have a high toxin load and a poor detoxification to come by once a year or every 2 years, and then we look at what has accumulated afterwards and extract it before it causes problems. Of course, I look, for example, if I see that my body is normalizing, I always check after 3 or 6 months, then it held, or does it rise again because something runs after? That is always the topic. You have toxins in the whole body, in all compartments. Now I pull them out from the blood, lymphatic system, connective tissue, but in the cells, it's still dirty. It runs after, and then you have to follow up with treatment. These are things that you naturally control. That's why you also make follow-up appointments with people and see how they are doing. I've been doing the job for over 20 years now with apheresis, which has only been around for a few years. But before, with other things, the principle is always the same. Only we see how people are doing, and we see that we can keep them stable.
Super exciting.
Not for more well-being, positive effects on the immune defense. These are all things that also improve the quality of life. And if a person lives with a tumor and can go about their work or enjoy their retirement, they can also do their job without having to suffer permanently, without constant pain, without constantly having to undergo any therapies that are burdensome. A lot is obviously gained. You can live for years with a tumor if it doesn't kill you.
Yes, if you now say you're also including psychoneuroimmunology, but you then have a healthy body that is powerful enough to perhaps tackle certain life issues that might also be connected with life.
The psychoneuroimmunology that you just mentioned is obviously also an essential point. If people are constantly afraid, if they are constantly undergoing chemotherapy, if they constantly have pain, then this naturally also suppresses immune performance. Because fear and panic and pain also reduce immune performance and life expectancy and quality of life anyway.
Perfect. Thank you for your work. Glad you were here. If one would like to read up a bit more on the whole procedure and what can be done, do you have any information for the viewers?
Yes, you can of course take a look at my website. There's also information there. Or just contact us. We provide any type of information the patient wishes.
Great. Thank you very much, Harald.
You're welcome, Corinna. See you soon.
Dear viewers, yes, it's wonderful that there are ways to really get all the junk out of the body and at least take a look at how much and where it is distributed. I hope you were able to take away quite a bit. Thank you for watching. See you soon. Goodbye.